So, welcome to a new episode, this time the season 2 of Smiles in the Air, your oral health and prevention podcast. I'm Celso da Costa, and today with me we have Philippe Gilmer. Philippe was a clinician for over 20 years as a physio-osteopath, and today is running the product management of Dollar Clast, our pain therapy business unit. So, welcome, Philippe.
Thank you, Celso. Thank you for inviting me.
So first of all, we need to explain what is Dollar Clast. We talk about pain therapy here, but what is it?
Okay, so Dollar Clast is a range of products we have here at EMS. So here, many people know the dental field with the airflow, and I won't go into all the detail, but the Dollar Clast is a range of products that we define more for musculoskeletal applications. So it's more out of the mouth, more into the body. Let's say we're going into many major aches and pains that people can be suffering from in their everyday life.
And I know that people are asking, well, this is a dental and oral podcast, why we are talking about Dollar Clast and musculoskeletal disease. Because honestly, we suffer from them, right? And just last week, I got a treatment with you to solve some problems. Can you explain a little bit what is this musculoskeletal diseases? What kind of types can we have as a dental practitioner working the mouth of the patients every day? And how can Dollar Clast help us?
Okay, well, let's take a step back. Not just dentistry and not just what's going to be interesting in your profession, but let's talk about the human body. The human body is made to move. You've got muscles, you've got joints, you look at your fingers, your hands, everything can move in any direction. The body is not made to not move. And one of the main problems people have today in their lives is the lack of movement. Now, this lack of movement can be because they don't exercise enough. That brings lots of aches and pains and strain on the skeleton. And then we have the other excess is that people don't move enough in their everyday life, in their work. It means they're keeping positions too long, and therefore this brings strain on the skeleton. And that's where we can really help, because we're going to be helping this extra strain on the muscles, on the body, on the bones and everything. And that's where we can really help people with all these musculoskeletal indications.
So, and how it works, the Dollar Clast? Because last week I got that treatment, and even if you feel the pressure, and in some points that you said, okay, here is a little bit rigid and you can feel it, it was a pressure that is not comfortable, but at the same time is so satisfying, because all of a sudden you have that and you don't have it anymore. Can you explain how it works?
Okay, so you're talking about the Dollar Clast as
Dollar Clast,
one product, but in fact we have a different range of products with different technologies. When I treated you, I used what we call radial shockwaves. So radial shockwaves are a mechanical stimulation that we're going to be applying on the body using our devices. We have shockwave devices and also laser devices that we didn't test together, but nevertheless, it's all about how we can stimulate the tissue in order to get it to respond. So what we did with you is using the radial shockwave device. So shockwaves are going to be applying pressure inside the tissue, but a very specific kind of pressure. And this is actually going to stimulate the tissues to respond, because the body, what I always said as a physio, the function creates the organ. What does that mean? That means if you stimulate in a certain way your body, let's take a simple muscle. If you stimulate it the right way, you train it the right way, it's going to develop certain properties.
Yeah.
And when you have strain and you have issues in your body, by applying a certain kind of stimulation, we're going to force the body to respond. And what we're going to do here is we're going to relieve the pain. We're also going to be able to relieve inflammation. And by doing this, we're actually going to trigger a healing process, which is totally natural. It's drug-free, no surgery, and it's a great alternative that can be used with pretty much any indication on the muscles and, many problems we have that patients have. Yeah.
The good thing is that of course, we are talking about the technology itself too, but you have a protocol that is quite similar to the guided biofilm therapy, that is the guided DolorClast therapy, that you see the patient as a whole too. So first you assess the problems, and funny enough is that I could complain about my arm, but you're going to check my shoulder and my back and see if the posture is correct or not. So you really assess the patient, you see where is the problem, the root of the problem, and not the symptom, and you try to attack the root of the problem.
Yeah, definitely. I think one of the most things I've seen as a trainer for medical devices is that many people are looking for a recipe. Say, give me a protocol. I want 2 minutes of this, 3 minutes of this, like a cookbook.
Yeah.
Like I put everything together and boom, it's going to work. It doesn't work. Human beings are all different. You're different to me, I'm different to you, and what will work with you will not necessarily work with me. And so as a clinician, it's really important that I am capable of assessing what you're really complaining about, but also moving all the way back to understanding what we call the root cause, is where does it actually come from? And this is where many practitioners struggle sometimes, because you came to me saying, yeah, I've got a problem with my foot. Okay, very good. Not for you, but for me, it's going to give me this kind of introduction. But the thing is, why is your foot suffering? And basically what you're suffering from is the tip of the iceberg. It means that there's so many things that happened before, and your body actually managed to compensate and cope with strain and stress. But in the end, one muscle needs the help of another one. So it creates a kind of reaction. At one point in time, one of the elements just cannot cope with the extra effort that's being asked.
Yeah.
And this is the part that's going to start suffering. But if I just treat that with a cookbook recipe, you're never going to heal, because you must understand where it came from. And so in your case, you were suffering from the foot. We went all the way back up to looking at the calf, looking at the whole lower limb, the tension in the muscles, seeing that all these elements are linked together. And this is where what we call the guided DollarClast Therapy concept kicks into place. It's all about understanding what our devices can do, but where are they going to be efficient? And if you're not capable of coming with understanding what's going on, you might not be applying the right technology to the right place to get the right results. And that's basically what the patient is asking for.
Yeah, and it's not only the assessment and the treatment itself, but it's also the education that you do at the end. Because people need to avoid the further problems, so they need to train themselves. So this is part of the protocol. Of course, why it's so important?
I think it goes a lot further than that. From what I understood in the past, when I say in the past, I'm talking about maybe 40 years ago. In a certain way, we used to consider patients as, I don't like to say this, but stupid. They weren't educated enough to understand what they were suffering from. So we spoke about indications and pathologies in Latin. Why Latin? Because that was the only educated people who would understand Latin. And that kept on going for many, many years, even till the late 80s. Med doctors were still talking about Latin. In anatomy, it was Latin. And we're now in a society where we have Google. Everybody has access to everything. And you sometimes even have your patients who come who know even more about their own condition than themselves. Well, at least they think they know more. The problem is, can they understand what they've read? Do they have enough knowledge to understand? And that's another topic we could discuss.
Yeah.
And I think what's really important is to say, a patient, if you don't explain to him why he's suffering from what he's suffering, he's always going to go back to the same problem and the same method, or I don't know how you can consider that. He'll go into the same routine that's going to cause again and again and again the same indication to start over. If you don't know why you're suffering from your foot, you're going to start again and again. And I can treat you every week. If I don't explain to you why this is happening, how are you going to understand? I think you're smart enough to understand.
I hope so too. No, but we had this discussion offline. So today the patients have a lot of information through Google, and a good professional is a professional that now can advise the patient and make the difference between the good information and the bad information, because they will appear with everything. And they have a hurt in the finger and they go to Google and they're going to find that it's cancer, and it's not. It's just maybe some extra effort that they have done. But the question is, we are suffering from this musculoskeletal diseases, and we were talking about the clinicians too. Most of the times it's because the ergonomic of the repetitive movements that we have done. How can we avoid this?
I think there are different steps that we can assess. The first thing, it goes into ergonomics. Ergonomics is how you can understand what's the best position to hold to enable your body to absorb the constraints that are going on. For example, I take your experience as a clinician. You're going to prefer using a stool that's adjustable in height.
Yeah.
If I have a stool that's too high, I'm going to be leaning down. My head's going to go up, and I'm going to be getting excess strain. And we've got many people today who are suffering from many of this pain in the neck post-COVID. And nobody has really understood that or taken the value of it yet, because everybody spent so much time for 2 years not knowing what to do, spending their days on their screens, on their phones, looking down, straining the neck. And this, many people now are starting to suffer from this because they're going back to adding up all this strain to their professional position where you need to adjust so that your eyes are relaxed, so the neck and the elbow is relaxed. So that's step one. It's ergonomics. Get yourself in the right position. Invest in a stool, invest in anything, a table that goes up or down, a treatment bench that goes up or down, so that you're in the position which gives you the less constraint on your body. That's the first thing you've got to do. And the other thing is move. You've got to move. Many people forget to move. There's no job in the world where you can't say, hang on, give me 10 seconds, get a break, relax, and move. And if you stay in the same position, I mean, I can defy you now.
Yeah.
Take your hand, just contract and wait like that for about 20 seconds.
Yeah, it starts to hurt.
It's going to start hurt because here there's strain. Here you're going to have contraction in the muscles, which means the muscles are going to be compressing the blood flow. There's no longer going to be blood arriving. You have to take time, relax, and start again. So you have very simple little things that you can implement in an everyday life to reduce all this strain.
Yeah.
And avoid these kind of issues that are going to build up, and then become a real problem.
And you have the habit when we have some kind of pain is like, stay still. Sometimes we need to move a little bit to start having that flow, right, of the blood and start exercising the muscles around to avoid the pain. That happened a lot, and I'm going to tell you by experience. So the first year that I finished college and I started working, I was working 12 hours a day. And to be honest, I didn't care about the ergonomics. I wanted to have the job done. Mm-hmm. And 1 year on job like that, you start suffering. And I start getting some problems on my neck, on my shoulders, on my back. So I said, okay, I will correct my ergonomics. And today on the trainings that I do is one of the things that I'm more keen on. It's like to correct the ergonomics of the participants. But I start also exercising a lot. Like every day I need to go to that cheap fitness room and move, like you said, move. So what I can understand, the advice that you give to the clinicians is to correct their ergonomics and to start moving. Do you think, but you said also in terms of the stool, the tables, the bench work, so maybe using loops to correct the ergonomics and using other instruments that make them do less repetitive movements can help.
Yeah, definitely. Any kind of instrument that can enable you to understand and realize what's going on is going to be a help. I take the example of this. You said when it hurts, you stop moving.
Yeah.
I'm going to use exactly that. The body always reacts to a stimulation that, ow, something's wrong. I stop.
Yeah.
But there's no message that arrives to your brain saying, hey, now it's okay, you can move again.
True.
You set in this warning system and you block yourself. And sometimes you go, ow, you sort of add an excess thing. But then before you arrive to the thing, can I test? Can I move again? Generally, it's blocked because your brain says, don't move, it's going to hurt. And in the same way, when you're working, at one point in time, you have to take a step back and say, I just need to relax a bit. Can I still move everywhere? If you feel tension, it means then you haven't moved enough.
Yeah.
And you can use that in a workflow, a normal workflow, and you can use it in everyday life, understanding that you have to tell your body, you have to move. If it's painful, try again. 1, 2, 3, 4, 5. You can repeat movements 10 times. Your body's never going to let yourself hurt yourself. If it's painful, okay, try again. Do it 1, 2, 3, 4 times and see if it eases off. And very often you do the same movement 10 times. And in many cases, pain just disappears. You just have to say, okay, can I do it again? It's a kind of neuro reprogramming of the brain saying, look, I can do this again. Let's do it.
That's important to know. The studies show that 75% of all dental practitioners, they suffer from some kind of musculoskeletal disorder. And but sometimes we don't know what to do. And last week we have done the treatment, and I posted live on the Instagram network, and I got a bunch of dental hygienists saying, yeah, I got that. It saved me. I wasn't aware. So that was a good surprise. And others saying, oh, where can I get that treatment from? So it's something that can help them?
Well, to find a practitioner, first thing, we have a clinic finder on our website, which enables people to find practices that have undergone a recent training. Now, this for me is pretty important because we discussed this as well. You said, I've already been treated, but not like this.
Not like that. Yeah.
And people also have to understand that many protocols exist in studies. And this is where I need to say you have to understand studies to know what we're going on about. Sometimes that you find protocols in a study that were done 20 years ago with certain parameters because that's what the devices could do. Technology has changed. There are new possibilities. And in this way, it means that people have to be trained again. And that's something we do at EMS in our SDCA, the Swiss DollarClast Academy, where we're going to teach patients, practitioners, how to treat their patients in the best possible way. Saying, okay, our technology has evolved. Studies are published every day, but some are relevant, some are not. And you have to be able to understand which one is really focusing what you need to know and which one is just there because you wanted to demonstrate a point.
Yeah.
And so that's where the practitioner's experience has to enable the patient to understand what's in there, what the information is, educate them. And that's where we need everybody to be able to be up to date in their clinical knowledge, to be able to say, okay, technology moves on, treatments move on. I mean, there's not a single field in the medical world that hasn't changed in the last 10 years. Nobody's still doing what they did 10 years ago. So it's really important that everybody stays up to date. And that's why, as I said, we have now a clinic finder that we've renewed very recently to make sure that patients who look for a practitioner really have this latest clinical knowledge that we have provided to them.
Yeah, that they are updated. Like you said, I got treated by the Dollar Clast, but never like that. What I enjoyed with it, and you can check on the social media, and it was really, really unpredicted. And I just told you, I have this pain. Can you help me? And you just guide me through everything that you were doing, explaining where you're touching other areas to find the root of the problem. And you were explaining also when you were treating and give me the guidance in terms, can I use more power or should I stay with the same? So there was a lot of control from my side too, which was good. And then at the end, and I think for the people that saw the video, it was so interesting because you said, how do you feel? And I said, nothing. And it was true. I was amazed. Delia was with us a colleague was with us on the room. And I think she saw in my face as like, wow, something is different here. I didn't feel the stiffness that was before. So everything was soft. Everything was so fluid. And I appreciate that. And I thank you again for it. And
You're welcome.
We need to post the link for this finder on the description of this podcast for sure. Anything that you want to add? Because now is the time.
Yeah, I could. I mean, I could talk for years. I'm really passionate about this,
I know that.
These products. It's really something that can change for a practitioner the way he works, and it can really change patients' lives. And I see many practitioners say, I don't want to use devices. I believe my hands are better. Okay. But a device used correctly, I mean, you experienced it yourself. When I was working, I would feel things through the handpiece saying, I feel something. Do you feel it too? And that's where it's really important to get this feedback, to get this connection with the patient, to work together. And I think there's something I want to add. It's this, is that we've got devices that can only be as good as the relationship between the patient and the practitioner. If the information is going forward, then we can adapt and we can really provide what the patient needs and get the best possible outcomes.
Yeah, imagine.
That's really what I want to put forward.
If you already have good hands, imagine to have this device in your hands. Like that was crazy. I went to another physiotherapist, same device, not the same treatment. That was crazy. So the training is also it's working. In your case, it's working really well.
Well, I just want everybody to come out of a Dollar Clast practice and say, that was great. If everybody could come out with the same experience, I'd really be satisfied.
No, for sure. I wanted to do the training myself and use it on myself. Like, but I'm not going to go.
I'll invite you in a training. You can come and see. I mean, you're invited whenever you want to come and see what's going on and test a bit on yourself and feel other parts of the body and what can be done.
Okay, great. I will
be my guest.
I will do that. Philippe, thank you so much for coming to the podcast. It was really insightful. I hope that we can help some clinicians, but also to open the eyes to other ones, mostly in the realm of pain therapy too. For all the listeners, thank you for being here with us for the episode. Don't miss the next one. Subscribe in every platform that you are used to listen to our podcasts. Can be Spotify, Apple Podcasts, or even YouTube. And we have the new page on the Swiss Dental Academy with all the podcasts, season 1 and now the season 2. So stay tuned and see you in the next episode.